All right. Hey, everybody. This is Rowdy family here tonight. We're talking about our week, our midweek update. How's everybody doing out there? We hope you having able to stay dry in this wet rain here in Oklahoma and the surrounding areas. And we want to express our deep, sincerest condolences for the losses that happened this week in Texas. This is something that's going on in this country right now. There's a lot of mental health issues. This young gentleman, I guess, did not have any pre-known mental health issues, and and then such a tragedy happened, and I know it affects us because we have kids in school at this time. Not right now, but kids in school in the elementary schools. Luckily, our schools are very safe and seem very secure. But you would think after all of these shootings and everything, schools would be safe and secure. And how are these people still getting inside of these schools with these weapons? That's my question. It's how are we, after all of these different tragedies that have gone on, how are they still getting in the schools? And then, there's mental health issues that we need to discuss on a national level as well. We need, as a nation, as a state, but as many states, we need to do a lot better at what we're doing. With mental health and what's going on here. I know it causes me extra worry because you work in a school district, and that's been your chosen profession, and you're still.
It's just my calling, I guess. But yeah, I do get it when a lot of this stuff goes on in the school. Just even when you think about stuff, even outside of the school shooting stuff, it's like I'm like in the middle of all of that. So it's like anytime anything happens, like it's always kind of like looking at me like, oh my God, mommy's like in the middle of that. So like with COVID and now the school shootings and all that kind of stuff, yes, everybody in my house is always worried. Like we're going to school too, but like, I don't know, like it's different because like I'm leaving and going. So it is one of those things that hit really close to home because yes, it is my profession. That is where I want to be. And it is scary because with all of this that's going on, and then you probably have some people that are probably on the other side of it where they're kind of like, well, how did it happen? Like the school should have been more secure, or this should have been more this. And sometimes stuff doesn't always like happen like that because there's like it can be some way that it can happen. And it's very sad that regardless of whatever was going on with the individual at the school, it's sad because there were babies, like little babies, 4th grade. I work with 4th graders, so it's very sad to see stuff like that. And
so we send all of our prayers and condolences to those families that lost family members and lost their children. We just are stunned beyond words with what to say. I know that it weighs heavy on everybody's heart. We're not here to talk about the gun issues and that. We're here to pay our condolences to those families. This is not a political issue. These are families that are hurting right now in our country for what? And so, we send our deepest condolences on that. it's hard to come back up from that, but we've got to talk about a little bit of other news. So what happened today with, we had a medicine appointment and we were surprised.
Yeah. So, the doctor, Dr. Dawn, which is the doctor that Nicholas has been seeing since, we've been seeing her now for probably about six months or so.
You're 7.
Well, 7 months, but however, she had worked with Nicholas in the past, so there was like somewhat of a rapport there. So she was our doctor that agreed to try the protocol with our son. And I know there are a lot of people in different states, or even in our state of Oklahoma, that say, oh no, my doctor would never go for it. He would never go for the protocol. It's absolutely not, no go. But in our case, it was a little different because she had worked with Nicholas before. She had prescribed medications to Nicholas before. And I explained to her that as I went down my log, hey, we tried this medication and this was what happened when he took this medicine. He took this one and this is what happened. So there was
she had that testing.
And then she, just based off all that, she suggested that we did a test called site testing with GeneSight. Thank you. GeneSight, where they did like a mouth swab, and then after that we got like a 14 page report that told him that told us what medications would like work better with his body. And there were all kind of medications. There weren't just one particular. It was from antipsychotics all the way to like pain management type meds, just what would be ideal, what wouldn't be ideal, and what would be something that was like in the middle. And it was interesting that a lot of the medications that we realized had a bad effect on Nicholas, they were most likely in the red on there, which were medicines that were not ideal for him. And we were like, hey, this is what we presented, all of the information to her about the protocol, about DMDD, how does it look, how does the protocol look. And she told us, she's like, hey, let's give it a try. And we also provided her with how it would get him to therapeutic levels. Again, we had our meetings, and in the meetings we talked about how his behavior started to how it is now. Everything was going pretty good. She was like on our side as to us telling her what wasn't working versus her saying, well, this is a medication that is known to be prescribed to children with these things that's going on. And she was just like, hey, every medication doesn't work for every kid. And I was just like, whoa, all right. So we had our meeting today, and we were waiting for Dr. Dawn to get on, and her nurse, he'd usually just kind of call me maybe about 5 minutes before just to give me the Zoom link, and then that was it. But we kind of stayed on the phone for a little bit, so I got a little nervous. And he was like, yeah, Dr. Dawn had an emergency, and she had to go back to the state she's originally from. And I'm like, wow. We now have a new doctor. And like, we were not expecting it. And like, as I'm like,
and it's a nurse practitioner.
A nurse practitioner, yes.
A psychiatric nurse practitioner.
So it's like, I guess he's going to.
So I can't say that.
Yeah. Practitioner. So yeah. And he's going to basically be in this position until they hire somebody for that position. So yeah. So as we are typing in the numbers and letters and all of that good stuff for the Zoom link, we're just sitting there thinking like, oh no, like, what are we gonna do?
Here's something. If your kids tell you that their dream career is in the medical field, tell them they can make a whole lot of money in the psychiatric field. If they're going to go to school, go ahead and get that psychiatry add-on in there. Whoop, pumpkin. Because there is a shortage of psychiatrists, pediatric psychiatrists, neuropsychiatrists, pediatric neuropsychiatrists. There are shortages of them around the state of Oklahoma, around the surrounding states of Oklahoma, across the entire U.S. So I hear this every week. And no, what more nobler profession would there be to be in right now at the cutting edge of the newer technologies that are coming out with psychiatry and diagnoses and this, the gene site testing. 10 years ago that was not in anybody's mind at all that you could get a swab and tell you. What was the other thing that he had to be on? They found what was it? The one that insurance wouldn't cover.
His folic acid?
Yeah. So they found
He had a folic, and from the gene testing?
Yeah.
That from that they also found that he had a folic acid deficiency. And that was pretty interesting. So he's also taking a high dose folic acid.
Yeah, that was real interesting because it was a defective gene where his body doesn't process the folic acid. It has folic acid in it, but it only processes it at 35% efficiency is I think what I read in this study. Mm-hmm. And so we found a really good brand of that that we purchased that's helps because the insurance wouldn't cover it. Mm-hmm. They saw it as a food. So there actually is a medicinal folic acid that can be prescribed, but most insurances don't cover it, and it's very expensive. It's a very expensive by itself pill, so you can find that, and and you can take high doses of folic acid to equivalate so that you have more to process, so more available for him to process at a lower level than neurotypical. So it's a genetic.
So that was our big concern. That Dr. Dawn is leaving, so we were afraid that this nurse practitioner would tell us, something like, "Oh, absolutely not. I don't know anything about this protocol, and I'm not doing that."
You hear that? We were lucky because we left this one doctor who was so arrogant and never listened to us, and then the other, he was up at Parkside.
Yeah.
They wouldn't listen to us and discharged him.
Yeah, discharged him because we told them the medications that they were going to put in his medical plan or treatment plan were the medications that he wasn't having.
They were the red.
Yeah, they were in the red, like fire hot red.
For the gene site. And we had already tried them and knew how violent.
Yes, and it wasn't one of those things that it's a couple of days, a couple of weeks. We gave it the time that they suggest. So it was about a month and a half. Actually, a lot of his medications, we went about a month and a half to see if it was like one of those type of medicines, like it gets worse before it gets better. And oh no, it's like as time ticked on during the day, it's like it heightened with these medications.
And antipsychotics,
Yes.
really, really not good for DMDD. They counteract the effects of what we need to do. So they really counter effect, and we don't really suggest, even if you're on the Matthews protocol, the suggestion is by Dr. Matthews' protocol in this brain-based treatment is that you do wean off of those antipsychotics before you start the the actual trilaptol. So just something to think about. But we were worried about that, and we went and talked to this nurse practitioner, and he was
pretty cool.
he's like, yeah, we're gonna keep him on that. He said, I've never treated anybody with the Matthews protocol.
He did ask us a lot of questions as far as like how is he doing, and then it was just like, oh yeah, he's good, and then it kind of followed up like,
is he happy?
like are you sure? Like, are you not just saying this? But he asked us a lot of questions, like as to, so we even gave him examples
What's
of
his
how.
demeanor?
Yeah, so it was like, what's his demeanor? How's his eating habits? Like, how is he with his siblings? How is he here? How is he there?
But those were things that Dr. Don already knew. So
Yeah, but these
and
are
I'm sure
also stuff in his like plan as far as what the stressors were and where the stressors, like siblings. He was having issues with siblings. He was having issues with transitions if he was having to leave dad and eye care, to go and be with a family member. So it was a lot of the questions that he was just, touching on. So I get it. He's new. He's getting to know us. So it was just like, hey, siblings were an issue. How is it with siblings now? Pretty good. And
really good. So, yeah, and so he's agreed to follow the Matthews protocol and keep treating Nicholas on the Matthews protocol. So that is the great news that we had this week. Still no luck with the lawyers or anything with the foundations that we're waiting on responses from to see if we can get some assistance in representing Nicholas in these cases in juvenile court coming up in June 24th, the first court date. So again, we love you all. Thanks for stopping in, listening to us yammer on this week, but it's okay to be rowdy. Rosa.
Yeah.
Time to stop the live.
Hey, Papa.
come on, ma'am. You gotta stop it.
Okay.
Tap the screen. There'll be a red stop sign come. Press it.